Hey everyone, it's Nurse Dani coming to you live on Facebook. We have a special guest today, Lindsey Shipley, the owner and founder of Lactation Link. And we are going to get started today by playing a little game of fact or fiction. We're talking all things breastfeeding today. So first of all, I want you all to get to know Lindsey because she's amazing. Tell everyone a little bit about yourself.
Hey mamas, thanks for joining us today. I'm Lindsey Shipley. I'm a nurse and a board certified lactation consultant, and I own Lactation Link. We have online breastfeeding classes and a great support forum, and I'm so excited today to be here talking on Intermountain Moms because you guys have a great page too, and we're so excited to kind of debunk
forces and let's
join
talk
forces.
About it. Yeah.
Let's talk together and let's debunk some of those myths that you're hearing, because we want to create confidence in this whole journey of motherhood and feeding your baby and all the different little milestones that come with it. I don't want people out there going, what should I listen to? What should I pay attention to?
Because, a lot of us turn to fellow friends, sisters, moms when we're looking for breastfeeding advice. Right. And just because you've breastfed a baby in the past doesn't mean you have all the right answers, right?
Right. Well, they can be a great source of support, but what we found is that each baby and experience is different.
Yes. So it's good to have a professional looking over your shoulder to see what you can do.
It's good to know all your options that are research-based, and then you can make great choices for you, your lifestyle, your family.
Yeah. Okay, so let's get started with a few statements. These are from some people that you've talked with. These are direct quotes, some things that lots of people want to know about,
These are from clients, new moms, expectant moms, things that they're hearing that they want to know if they're true or false.
Okay, so let's get started with the first one. If I can't feel a letdown, my milk supply has decreased.
Right. Okay.
What do you guys think?
Type it in the comments.
If you can't feel a letdown, has your milk supply decreased? We'll take a little vote here.
Yeah, fact or fiction in the comments. And then I'll give my answer. That's one of the ones that's fiction. A lot of times moms have these little indicators that they'll rely on to think, something's going wrong. Mm-hmm. When in actuality, feeling let down or how full you are or things like that aren't reliable indicators.
And breast size. I hear that all the time too. I feel like I'm smaller. Am I making less milk? Right.
Because there's a lot of different factors. As baby grows, they get better at removing the milk. Mm-hmm. And so you're probably going to be less full. And then the letdown specifically, on average, moms have 4 letdowns during a feeding. Some moms describe it as a tingling sensation. Some moms describe it as, they feel nothing at all, and that's okay too. Some moms have a little bit of pain with it. So it varies from person to person, and you shouldn't think, I can't feel my letdown, so I don't have any milk.
So what are the best signs to determine if you are making enough milk then?
Right. So you need to learn how to read your baby because we can't see inside our breast like we could see inside of a bottle, right? And so if baby has a good latch, okay, you're hearing swallows, that means that milk is being transferred from mom.
Because in between letdowns, they'll kind of the sucking may change. Yeah. They're not sucking, swallowing, sucking, swallowing. So you can hear that.
So a bottle is a steady state of delivery, of that milk volume. But breastfeeding is much different. It kind of goes in a wave.
It's not like turning on a faucet and having it free flowing.
Exactly. When baby first goes to breast, they're just getting the small amount of milk that's kind of right there at the very forefront of the breast. And they're stimulating. They're doing these little fast sucks. So that's something you can watch for. And then as the letdown happens, their chin starts to drop. And you start to hear those little swallows. Might not happen in the first couple days because your milk is kind of starting to build up and establish, right? But you'll start to hear those swallows, and then after the letdown kind of comes back down, then they have to stimulate again. So you'll see those fast sucks and maybe a pause. Then they'll have another letdown. So it kind of goes up and down like that. So other things to look for to know that baby's getting enough. Weight gain. Are they having good head and length growth as well? Those are really good indicators to look for too. It's not only weight, it's also, is the head circumference growing and is their length growing? Are they active and alert throughout the day at different times? Do they have good muscle tone? Can they push against you? Things like that are all kind of what make up the picture of what a well baby looks like. Sometimes we're just so focused on weight gain only that it can kind of distract us from what's the full picture. And so I think, your lactation consultant can help you with that. Your provider can help you with that so you can have confidence that baby's growing and doing well.
Good advice. I want to interject a question that we got that kind of is along this topic. Ashley Shaw-Tusher said, my 5-month-old seems to always fall asleep at the breast. We do wake, feed, play, sleep, but it's not helping. Any ideas? And in between letdowns, your baby may fall asleep. So address that issue.
Perfect. So a couple things for Ashley. A lot of times we tell this to moms that have newborns, but anytime that baby starts to get sleepy at the breast, it's a great idea to dress baby down to a diaper for every feed for several days to see if that makes a difference for them to be a little bit more alert. Okay, with that skin-to-skin contact. So that's number 1. Number 2,
and you can do skin-to-skin not just in the first few days or even a few weeks. You can do it for a long time and enjoy the benefits of it.
Number 2, if baby's gaining weight well and hitting their milestones, you may not have to worry if baby falls asleep. They may just be more efficient at removing the milk that they need, and then they're kind of going to sleep because they're totally happy and their tummy's full. So that's another thing to think about. And then number 3, if they're really not getting enough, minutes at the breast, or they're kind of just right on the borderline of getting their weight gain, start doing some breast compressions during those pauses or when baby starts to fall asleep.
And breast compressions means you're like squeezing.
Right. So baby's latched and you have your fingers right here and you're squeezing and holding. Okay. It's not squeeze open, squeeze and hold. And that can really help to stimulate a little bit of more milk getting pushed out.
That'll get them sucking more.
Then you can see them start sucking again and you keep holding until you see that suck slow down. Then you can open your hand and do another compression, and that should elicit them to start sucking again. So those are 3 things. Was it Ashley that wrote that in? Yep. 3 things for Ashley to try and then get back to us.
Awesome. Okay. Fact or fiction number 2.
Okay.
My baby is 2 days old and eating much more frequently than the first day. Something's wrong.
Right.
Fact or fiction?
Must be that this mom isn't making any milk if that baby's, eating more on that second day. So we'll give you guys a quick second to write in there in the comments. Do you think that's fact or fiction? If on the second day.
Logical to think that.
Right.
It wouldn't be.
Yeah, and a lot of moms have this question for sure. So I'll give my answer that it's fiction. Write in there in the comments. Do you think that's fact
or we get to hear you?
It's fiction because we call it second day 2 cluster feeding is what we call it. So right after delivery, immediately after, baby's pretty alert. If you turn down the lights, they'll open their eyes and they'll make their way to the breast. And then that first day, after that first hour or 2, they're very tired. Being born is hard work. So they want to get a lot of rest in. It's still important to feed, frequently during that first day. But that day 2 is a lot of times when they start to wake up and go, wow, I'm really in this world now. And I'm hungry.
Yeah.
And I want to learn how to breastfeed, and also that sucking motion is very soothing to me. And so they will cluster feed throughout that whole second day. And your response as a mom, if that happens, should be, yes, things are going
Let it
just
happen.
as they
Don't
should.
think something's going wrong.
Yep.
Right. And along that topic too, how long does it usually take most women to have their milk come in?
Right. It takes about 2 to 4 days for that milk supply to come in. But what we like to say is more milk to come in because you have milk when baby's born. You're actually started producing milk in your second trimester of pregnancy. So anybody that's on here that's past about, 20 weeks, in pregnancy, you're already starting to make milk.
And I'm going to throw in my own fact or fiction because I hear this all the time. People want to know if they can squeeze out a little bit of milk during pregnancy, they're going to be an overproducer. If they can't squeeze out any milk during pregnancy, they're not going to make any.
Yeah, right. Once again, so if you have some leakage during pregnancy or you're able to, hand express some milk, not a good indicator whether if you're going to be able to make
doesn't really have anything to do with supply. It's normal to be able to get a little bit out, but if you can't, that's okay too.
It's okay too. Yep. Mm-hmm.
Okay.
100%.
All right. So, fact or fiction number 3. The composition of my breast milk is perfectly suited to my baby's needs, even if my baby is born prematurely.
Okay. So if baby's born early, 30 weeks gestation even, my answer would be fact. Breast milk is perfectly suited. It's crazy how smart our bodies are.
It is.
At knowing,
it's amazing.
Wow, that baby's come out and it's only been in there for 30 weeks. And I know that I've got to increase the sodium. I've got to, increase protein. I've got to decrease this.
That is so amazing to me. And the importance of getting breast milk into a baby's gut is so important. That's such a good foundation. They need that.
It's like kind of laying down a paint primer. Like if you were going to go and do an accent wall in your home or wherever you live, you would lay down a paint primer to protect the wall and kind of prepare it for that future permanent covering, which would be your accent color. Same thing with colostrum and baby's, first milk, is that it's kind of protecting that delicate newborn gut and getting it ready for the processing of future foods. So it's so important, whether you can do it for a couple weeks or a year or whatever you're able to do as much as you can. And especially if baby's born early, get some help to be able to do that.
I remember taking mothers over from labor and delivery to the NICU when their babies went over because they were born early. And the first thing we would do after they got an update on their baby and talked with the doctor and nurse and spent some time with their baby, we took some pictures and everything. We'd say, where's the pump kit?
Yeah.
We're going to get you the pump kit and get you pumping, and you save every single drop that you get. Even if you feel like it's not much, we still want every drop because it's so important for all babies, especially premature babies, to get that established.
Yep, for sure. So it's a very powerful liquid gold.
It really, really is. Now, what about, along those lines, what if someone wants to donate breast milk because sometimes for one reason or another a mother doesn't have milk available to give a baby, especially for premature babies, and there are donor banks and the NICU draws from those when they need to. So
100%.
how can a mother donate?
Right. So they're actually working on getting a milk bank here in Utah. It's something
we need one. Why do we not have one in the baby producing capital of the country?
There's a lot of cost that goes into it. There's a lot of logistics that go into it. But I know the group of people that are working on getting it set up, and hopefully it will be set up in the next year or so. So in the meantime, when NICU needs to draw, they draw from maybe a bank in Texas or Denver. And so, right now, if that's something you want to do, you would want to contact those milk banks. It's called HMBANA, HMBANA. And they would kind of give you, see if you qualify first, because, if you're healthy, and you don't have a lot of chronic illnesses or take a ton of medications, most likely you're going to be eligible. And you can donate that way. There are some local groups that, it's not really, it's a little bit more just, if you want to donate and if women are okay with accepting it without being
all the
screened.
screening.
It's called Eats on Feets. And you can contact them and see if it's something you're comfortable with doing. Yeah.
So what if you have a whole bunch of milk in the freezer and you don't want to throw it away? When you donate, does it have to be fresh or can it be frozen?
Right. I think that they can do at different stages where it is. So definitely frozen is totally fine. And every time when you contact them, they'd give you the
They'll
specific,
talk with you about what they can accept and what they can't.
Exactly. And then along those lines, when you're freezing, make sure to date the bags, lay them flat, and then pull out the oldest first, so that you don't get to a point where I've used all my more recent milk, and then samples. It's gonna go bad if I don't use it soon.
And how long does breast milk stay good for in the freezer?
So in a regular freezer that's attached to your fridge, you can keep it in there for 5 to 6 months. Well, like I said, store it flat, away from the doors. You don't ever want to put it on the door that's going to swing open, because that's exposed to a lot of temperature change. If you have a deep freezer, it can be good for up to 12 months.
Wow.
Yeah.
And would you recommend storing it in 2 to 3 ounces at a time to reduce waste?
Great question. 2 to 4 ounces.
2 to 4.
Perfect. It's actually a perfect portion size for a breastfed baby. So once they're past about a month old, that's when moms hit peak milk production. Okay. And no matter how old they get beyond that, 2 to 4 ounces is the right portion size for a breastfed baby. So a lot of times when babies get 5, 6 months old, moms think, I need to keep increasing my volume to keep up with baby. But actually, breastfed babies, they eat more frequently than formula-fed babies, but they metabolize really efficiently. So they just need about those 2 to 4 ounces. So you're right. Perfect amount to freeze for your caregiver for when you're going to be away or traveling.
Well, good advice.
Yeah.
Okay, fact or fiction number 4. Colostrum is milk and is usually enough to meet a baby's needs. We actually kind of addressed that
We
one
kind
already.
of addressed that, so I think that everybody's going to be,
everyone should know. Fact!
A star student. I guess the only thing I would add to that is a lot of times moms think, well, I better supplement until my milk comes in.
Yes. There's actually quite a few people who think that. They're not making milk, so they need to give their baby formula. Yeah. So yes, let's talk about that.
So for the majority of times, full-term babies, colostrum is going to be enough to meet baby's needs because their stomach capacity is really small when they're born. It's actually like 1/6 of an ounce. It's a few swallows. So maybe baby's at breast for 20 minutes, but they're really only getting a few swallows of that colostrum. But because their tummy is so small, that's all they need, as long as you're feeding them frequently. So it can be hard to kind of conceptualize that when we see bottles that are kind of pre-filled.
Yes.
But the actuality is that even formula-fed babies are only taking a little bit of that filled bottle, and then it's discarded. So boost your confidence by knowing that my body was made to do this. I just need to feed frequently. Kind of try to forget about the clock, and not go, I have to wait this amount of time before I feed baby. Watch baby's cues. Do lots of skin to skin, and that colostrum is most likely going to be enough for your baby. Now, obviously, there are certain instances when babies are born early, or that, baby's just having a little bit of a harder time getting started. And then, discuss with your healthcare provider and that to see if supplementation is something that's necessary for you. But
there's
most
other
of the
things
time,
they can do that are friendly to breastfeeding, so that it won't cause nipple confusion and issues with breastfeeding later.
Absolutely.
Yeah.
That's why we always teach every mom in our classes how to hand express milk, because hand expression can be more useful than a pump in those early days. Because of swelling and engorgement and things that happen, it can be hard to get the milk out with just suction. But if we use our hands, sometimes the milk flows a little bit more freely. We can put it on a spoon or a medicine cup and get baby those calories. Just because baby didn't latch, the colostrum still has lots of good calories in it that can keep baby's blood sugar up and kind of, like you said, keep those breastfeeding goals intact.
Yeah, good advice. Okay, I love this one too, especially around this time of year, because a lot of moms get sick and think that they can't breastfeed.
Okay.
So if I get sick, I should stop breastfeeding and just pump until I feel better so my baby doesn't get sick.
Right.
Fact or fiction?
Fact or fiction, mamas. So what I'm going to say is fiction, okay? Because mom and baby share a lot of the same germs. Okay. And actually there's studies that show that when baby goes to breast, when mom has a little cold or something, when they lick that nipple and areola, they're building up their immune system. And a lot of times the baby won't even catch what you get. And if they do catch it, they get over it a lot quicker if you continue to breastfeed throughout.
Because you're passing immunity that your body's building up to the baby. And so it's offering them protection. So not only should you continue to breastfeeding like you really need to, but then there's measures that you could take to reduce the chance of them getting sick. Like while you're breastfeeding, don't cough and sneeze directly on their face. Right? Like I remember I got a cold like when my daughter was just... she was just about 2 months old, and I was so nervous about it. I just went and got a few masks and wore a mask when I breastfed her. And you just wash your hands really well, and it's very, very possible for you to be sick, but for your baby to stay healthy, especially if you continue breastfeeding.
And all of those disease-fighting properties that breast milk is made up of are going to just help baby, fight anything that does come their way, whether it's germs from you or germs from just their environment.
Well, and hydration. Sometimes when you get sick, you become dehydrated, so it's important. Do you notice a decline in milk supply if you get sick and you become dehydrated?
Well, I think it's important to drink to thirst. And sometimes when you're sick, you don't feel like eating. You don't feel like drinking, So in normal everyday life, don't feel like you have to drown yourself in water. Because there's actually studies that show you can drink too much water. And that can kind of do some fluid spacing and can decrease your milk supply. So in normal everyday life, drink to thirst. Stay hydrated, but you don't have to be crazy about it, right? If you're sick, you want to try to push yourself to have some liquids at your bedside and keep up on that and eat things that are going to be easy, like smoothies that have calories and things like that, so that you can get past that. A lot of times moms will feel like I was sick for a day and then I woke up and my milk supply was gone. Not possible. So you might be sick for a day. You want to try to keep stimulating as much as possible, but get right back on track as soon as you can, and your body will respond and everything will be fine.
What about decongestants? That's something like if you get sick and you want to take decongestants, those can kind of slow supplies. So if you're taking a whole bunch of those, that may actually
something like pseudoephedrine, can if it has that ingredient, if you look at the different ones that you're going to take, could definitely affect. So have caution with that ingredient, but everything else, obviously consult with your physician, because you may be taking medications that could interfere with something. So anytime you get medication involved and you're breastfeeding, consult your physician, consult the Infant Risk Center, which has fantastic, the most up-to-date resource that you could just type in Infant Risk Center. They actually have an app called Mommy Meds that you can reference at any time that will give you the most up-to-date information on how medications interact with breastfeeding.
Oh, that's great.
Yeah.
Because oftentimes you're wanting to know what you can take. It's always at night or on the weekend.
Exactly.
Never when you
when
can
no
call
one's
the doctor,
around.
right?
So mommy meds to the rescue.
That's great. Okay, and the last fact or fiction before we move on to some more questions that we've gotten.
Perfect.
Is pumping is always more efficient than hand expressing your milk.
Right.
Fact or fiction.
I gave a little cheat sheet earlier on that. So my answer would be fiction. There are times when hand expression is more efficient than the pump. And sometimes moms look at me like I'm crazy, right? Oh, I'm going to have time to sit there with my hands and da-da-da. And so the trick is that times, right? So pumping is a great tool. I'm so glad I had a pump when I went back to work as a nurse. I'm so glad that there are pumps for situations where there's ill moms or babies. I experienced a very unexpected illness with my second baby, had to do 3 surgeries and things like that. And I was able to keep breastfeeding because of my pump, right? So they're great tools, don't get me wrong. But there are times when hand expression can be more beneficial, okay? So the early day, that first day right after delivery, research shows that you can actually get more colostrum out through hand expression than you can with the pump in those first few days. And like I said, it has to do with kind of fluid overlapping and some inflammation and things like that. So the compression is what really helps the milk fall more than suction at that point, okay? There's other research that shows that moms that do these short sessions of hand expression throughout the first 2 weeks have a better milk supply down the road than moms that don't use hand expression.
How interesting.
Yeah. So just a few minutes, several times a day, it kind of acts as your insurance policy for a great milk supply.
Yeah.
Yeah.
You kind of want to do whatever you can to build it up. Oversupply can be a problem too. That's a whole different beast. But I would say, generally speaking, more people have a problem with underproduction rather than overproduction.
Or thinking that they have underproduction.
The perception of, that's right.
You know,
that's exactly right.
So hand expression's a great tool. You definitely want to learn it. You can even start practicing it in your last trimester, you know, to kind of just get used to that motion and knowing that it's okay to touch these guys, you know.
Avoid nipple stimulation though, because that can cause contractions. But actually, like, the motion
just kind of
massaging
learning
the
how to
breast,
massage, you know, just quickly in the shower or things like that can kind of go, oh, okay, this is okay. And my breasts were made to make milk for my baby. And this is something that's going to be really good for me to learn how to massage and to eventually hand express for sure. And then also whenever you're pumping, so you want to add hands to maximize your pumping session. So you want to have like a hands-free bra or just cut some small holes in an old sports bra so that your hands are free and you can do some massage and compression while you're pumping to maximize that session.
I like the cut the hole in the sports bra idea because the other bras you buy for that can be really expensive, but everyone's got an old sports bra on hand that you can use.
For sure. So I think it's, totally up to your situation. If it's something where I'm working every day and I'm going to be using the bra a ton and I want something that's going to hold up and be great, then maybe consider, you know, investing in something like that. But if you want to test it out first and, you know, maybe I'm just going to be occasionally pumping, for sure. Grab the old sports bra, put small holes, and your flange will go right through that, and it'll be a great little makeshift.
Awesome. Okay, well, should we get to a few questions that we've had? Okay. Evelyn says, my boy is 16 months and is still breastfeeding. I only produce milk on my right side, and he refuses to latch on the left. Is that still okay?
If it's okay with Evelyn, sure. You know, so there's no problem. Not a lot of times, but sometimes moms will go to just feeding on one side. The reason why we always say, hey, try to switch off and try to even it out is because of appearance. You know, we don't want moms to be embarrassed if they kind of feel like they're lopsided on one side than the other. But if it works well for her and her baby and the relationship is still really great, the breastfeeding relationship is something they want to continue and they're getting benefit from, there's no problems with that.
And babies may often favor one side just because they're more comfortable, more familiar.
Yeah, totally normal. Yeah.
Okay. All right. Mari says, number 1, how do you help a baby know not to bite without having them associate the consequence with breastfeeding?
Right. Okay, Mari. Okay. So biting can be a big thing, right? We say the word biting, we just go, we don't want
everyone is like, oh.
Even the men in the room are cringing, right? And so a couple things that you can do. Typically, babies start biting around maybe 5-6 months, okay? And typically, it's when they've gotten a little bit better at breastfeeding, so the sessions tend to be a little bit shorter, and they can get what they want, and they're ready to play. And if you start really observing them, giving them that eye contact during the feed, you can start to anticipate that behavior. When they're done actively sucking, and they're smiling at mom, and they're cooing, and they're wanting to laugh, that's what happens right before they bite. Okay, so if you can anticipate that behavior and kind of put your finger in their mouth and get them off the breast and redirect them to a peekaboo game, reading a book, a snuggle session, then that's going to reduce the chance that they're going to bite in the first place. Okay, but if prevention would be great, right? In a perfect world, but we don't. That doesn't always happen, and sometimes the biting still happens. So if that happens, you definitely want to look at your baby and say no about 3 times. Try not to yell or scream, because that can bring on,
startle, make them afraid. Yeah, create negative feelings associated with breastfeeding, right?
It's hard though, because sometimes that could be a knee-jerk reaction. Yeah, it's hard. So try to minimize your reaction if at all possible. And then tell them no 3 times. Okay, and give them that eye contact. They can go back to breast at that point. And if they do it again, then you want to put them somewhere safe. Put them in their crib. Put them in kind of a cornered off section of your home and walk around the corner. And so that they know, okay, I did this behavior. I was separated from mom, which I don't love. Okay. And then come back and talk to them. And you might feel silly because they're 5 months, but just say, hey, when you bite, that hurts mom, and I'm not able to feed you when you do that.
Yeah, because they don't necessarily understand the words you're saying, but they get verbal cues. They get facial expressions and body language. And so that makes a big difference.
For sure. And then just keep working with them, So
you can't expect perfection the first time for anyone, especially little kids and babies.
They think it's funny, right?
Yeah.
My son's, he's 6 years old, and he still thinks it's funny if he steps on mom's toe, or
if they tease and get a reaction, they're going to do it again.
Exactly.
It's funny that the same things we talk about with babies still apply when they're 2, 3, 4, 5, 6, 7, 8, 9, 10.
Exactly.
Yeah. Okay, she has a second question. What tips do you have for keeping your supply up and flowing? That's just a very, very common question across the board, I would guess, is what can I do to increase my supply?
So first thing is I want her to, if baby's growing well, hitting their milestones and doing good, first of all, I want her to feel confident that she's making enough. Okay. Sometimes we look at a friend who maybe has an oversupply or maybe has 10 bags frozen of milk in their freezer, and we go, I don't
feel like you're failing.
My supply isn't what it should be.
Yeah.
Okay. When actuality, those are outliers. Those are kind of the unique situations. But if you're providing for your baby and they're hitting milestones and weight gain, you're doing what you should. So that's number one. Okay. And I want everyone to feel that way and know that. But if you're like, hey, I would like to make a little extra, or baby is maybe just right there on the growth curve and might need a little more boost, I would do things like something like a breastfeeding boot camp. Some people call it a breastfeeding vacation. Okay. It depends on what your philosophy is. But really, you try to cancel a lot of outings or activities for a day or two, maybe get in bed with some Netflix, and put baby to breast as frequently as possible over those next 2 days. If you have other kids, try to set up play dates, try to maybe have family or friends help with them for a few days. If that's not possible, set up some toys on the ground, things like that, and just feed baby much more frequently over the next couple days, and it can boost things right up. There's another thing called power pumping, where you can set up a little station somewhere in your house where you're going to pass by frequently. Okay. Every time you pass by that station, which should have some water, maybe a remote right next to it.
You can put a yummy treat there. That will entice you to stop.
Dani knows. Yeah. Dani knows where everybody's head's at, right? Yummy treats. Put some things there that you're going to feel okay being in that spot. And throw the pump on for 5 to 10 minutes. Okay. You actually don't have to store the milk right away. You can keep the milk in those bottles for up to 5 hours.
And if you're stopping frequently, then just wait till it's full.
Wait till that 5 hours has gone by. And then you can store it, wash, and start again. Excuse me. So power pumping, doing that for about 24 hours and then going back to your normal routine can also help you see a little bit of a boost in your supply.
So you're going to have to make some serious effort for a couple of days. After that, you should see a difference.
Yeah.
I love that, like a vacation or boot camp. That's great too.
Exactly.
If that doesn't work, talk about like medications, supplements, that kind of thing that people wonder about.
Exactly. Yeah. One of my most frequently asked questions on Instagram or in our classes is, what's the magic pill?
Yep.
What's the magic powder that I can take to just have this booming milk supply? And dang it, there isn't one, you know?
That's not what anyone wanted to hear.
I wouldn't have a job if there was,
That's
right?
Exactly right.
No, but there really isn't a magic pill or a powder or supplement, you know? There are lactation bars out there, and I think they're okay if you watch the sugar content and if you look at them more as like an energy bar, you know, and you don't think, oh, this is going to double my supply overnight. And I would also keep in mind that everybody reacts differently. So one mom might take a supplement like fenugreek, which is an herb that's kind of anecdotally been associated with, you know, helping with milk supply. And one mom might feel like that helped her. And then another mom takes it and she feels like it did nothing. You know, we don't have research that shows take this supplement and it's 100% going to help every mom with their milk supply. We do have research that shows increased stimulation. So through the pump, through hand expression, or just feeding baby more frequently is going to be the number one thing that's going to help your supply.
Can we briefly talk about growth spurts when it comes to that too? Because that's a natural way for a mother's milk supply to increase, because the baby is the one who's giving the cues to feed more frequently.
Right. Yeah.
How often do those happen? How long do they usually last?
They can happen throughout your experience. You know, some moms will say, oh, classic growth spurt times are about 6 weeks, 3 months, 6 months in that first year, you know? So those are things that you can expect, but I also wouldn't freak out if they happen at different times.
In between, yeah.
Yeah. And I think what you're talking about, Dani, is when baby just wants to go to breast a lot more frequently than they have been.
And then a lot of times mothers think, well, I'm not making enough. Why do they want to eat all the time? And that may not necessarily be a problem.
Yeah.
It's just...
So I think growth spurt is definitely something to pay attention to, but I would also, for the moms out there that are going, I'm not making enough, baby wants to go to breast very frequently, you're missing half of the equation. Breastfeeding is about more than just food and calories. It's also about emotional needs. And for some reason, your baby might have more emotional needs for a day or two because maybe just routine has changed a little bit, or maybe seasons changed, or maybe just something is a little bit different or off to them, or they just need something right then. They need mom. And so they want to go to breast. And yes, they're getting calories and breast milk, but they're also getting that emotional need met, which is just as important as their calories.
I love that.
Thanks.
So when you're weaning a baby, a lot of people have issues with losing that emotional connection, like especially people who are weaning toddlers that have, you know, just turned 1 or almost turning 2.
Yeah.
They're going to miss that connection. So what can they do to kind of bridge that gap for the baby and the mom?
Yeah. I think it definitely can be a bittersweet thing, you know, because maybe mom's seeing, okay, baby's kind of leading this process and they're ready to move on. And that's great because they're developmentally, you know, they're hitting milestones and they're doing what they should be doing growth wise. So you can feel sad. That's totally okay. Yeah. You know, so have a little moment, or maybe write something in your journal about the experience. So you can always look back, take a picture of breastfeeding. I wish I had pictures of breastfeeding, like with me and my baby.
I'm kind of ousting my mother-in-law, I guess, but she has a picture of my husband when he was little and he was nursing, and we pulled it out once at a family party and everyone was laughing so hard. And she was like, well, I loved it. I loved that time in life. And so,
and maybe it's not family party material.
Right. But for her, it was special.
For her, it was huge. Yeah. You know, and I wish I had those, you know, and we do pictures all the time so that we can teach moms, you know, this is what certain things look like, and they can be so important. So take a picture, write something in your journal, and then replace that time with other activities with you and your baby. You know, like I said, reading together, playing a game, playing peekaboo, going on an outing at certain times of the week, you know, making a mealtime really special.
Or still taking that time to stop and cuddle. Because as they get older, we just kind of like move on with life and we don't take the time to do that.
And that phone can get in our way too. A lot of times I remind moms, even before weaning, you know, when, hey, baby's just really distracted at the breast and really da-da-da. And I did it too, you know.
Think about what you're doing.
Try to put that phone away, turn the TV off, and get back to that eye contact that you gave them when they were newborn. And you'll really, you'll start to see a change and less distractibility, and things will help if you do that. So,
that's great advice. Okay, Kylie says, any tips for what I can say to people who seem appalled that I'm still feeding my baby even though he's past the 1 year mark?
Right. Oh my gosh, yeah. So like we said earlier, everybody's journey is going to be different. Okay. And for Kylie, that's something that's really going well between her and her baby. It's something that's really beneficial.
Yeah, a lot of people are like, well, I need to stop nursing because my baby turned 1.
Right.
And it's like, no, there's no one telling you to do that. If it's going well for you, your baby's doing well, you're enjoying it, there's no need to stop.
And sometimes moms hear, well, there's no nutritional benefit. Not true. Not true at all. There's still all those disease-fighting properties. There's all those antibodies in there, and baby's definitely still building up their immune system. So at 12 months, as far as the calories and the majority of the diet starts to shift to solid foods at 12 months.
And whole milk, they still need whole milk even if they're breastfeeding.
And then breast milk fills in those nutritional gaps. Okay, so it still has tons of nutritional benefit, immune benefit. So if you hear that, just dismiss it right away. Okay, but in addition, a lot of times these people that are talking to Kylie are probably going, well, you're going to spoil that kid. If you just let them breastfeed whenever they want, or, they're going to be really clingy. And is that something you want? Those are things that I've heard. Okay. And studies by psychologists, child therapists actually show that the more you respond to babies' needs when they're young, the more independent they are as they grow.
Interesting.
Yeah. So she's not going to have any problems with baby being clingy or never being able to, interact socially or things like that. She's doing a perfect job. But I think what she's saying is, what do I say to these people? And so I think, that's something for her to decide, but I think you could ignore them if you'd like. Number 2, you could address it and you could say, hey, this is something that's working for me and my baby. Thanks so much for your input, but I'm going to keep doing what I feel really comfortable and confident about. Sometimes that takes guts, but you say it once.
Who can refute that? Who can say anything to that, back to that?
Right, right. So there's also things about breastfeeding in public, where there's 2 parties, it seems like. One that says, hey, mom should be able to do what she feels comfortable with. And there's another party that's very much not okay with it, So as a society, I feel like, a mom should be able to do what she feels comfortable with. Would you walk up to a mom that was feeding with a bottle and berate her? Right. On the other side. So I think the more that we can teach our kids at a young age where babies get their milk, my kids ask me about that kind of stuff, and my 5-year-old, I go, oh, actually, you actually got your milk from mom and from my chest, and this is how it works. He's got, really? Ew, mom.
Or if you have a younger toddler when you have a baby, they're curious. They want to know what's going on under there.
But the more you talk about that, the more you normalize that. And you can also say, well, some babies get their milk from a bottle. And some babies, do it this way. And they're both good and they're both great. And it starts to normalize things at a young age. So by the time they're an adult, they're not walking by somebody that's sitting on a park bench and scoffing at them feeding their baby. Yeah. So it's kind of a society issue. Unfortunately, Kylie's kind of getting the brunt or the embarrassment that comes from people they're not used to it. They didn't see it in their home. They didn't talk about it, so they feel uncomfortable.
Right. So. And that's not her problem.
Right, for sure.
Okay, Catherine says, if my baby has jaundice, is there anything I need to do to supplement his feeding?
Right. So if baby has jaundice, first thing I'd say is 50% of newborns have some level of jaundice. So a lot of times that is really scary for moms. It's actually a very normal process that happens. You want to watch it, obviously, because we don't want anything bad to happen. But the best thing you can do is feed more frequently, do those hand expressions in between sessions like I mentioned, and give baby those extra calories on a spoon. Okay. Keep checking in with your healthcare provider to make sure that those numbers are.
Yeah, they want to get blood levels drawn daily to make sure it's coming down. And what it is bilirubin in the blood, and it's excreted in the urine and in bowel movements. And the more they eat, the more they're going to pee and poop. And so that's going to help the excretion of the bilirubin.
So you may want to check with a lactation consultant to make sure that baby's transferring milk. So not just that they're at the breast, but they have a good latch and they're removing milk, number 1. Number 2, get them some more of your own milk if you can through that hand expression. Check in with your healthcare provider, and as long as those numbers are going down, you should be okay not to supplement, as long as that's what your healthcare provider is okay with. If the numbers are continuing to creep up, then that's going to be an individualized recommendation with your pediatrician, for sure. Yep.
Okay, good advice.
These are some great questions,
they are,
ladies.
Aren't they?
Yeah.
We have a few more. Can we keep going?
Yes, we can.
Okay, Jessica says, I'm 32 weeks and I'm leaking more than 2 ounces daily. What do I do?
Yeah. So she could save that if she wants and put it in her freezer. If she's able to, there's actually things called like a milk saver or a Haka device that if she knows, oh, I'm kind of leaking out right now, she can put those things on and collect the milk and save it.
So would this be like the same composition as like colostrum?
Yeah, I think it would be, for sure. And so she can save that, and she doesn't have to worry about like, oh, I've got to give that right away. It's just, you could just add extra calories, at any time. At any time, because it'll all kind of even out. If she's like, no, actually, I work full time, I don't really have time to catch this milk, then just start wearing some nursing pads. Yeah, and then that will save you from any leaking through or things like that. But don't be alarmed that that's happening. Yeah.
Kaylani says, is it normal for my 10-month-old to still wake up multiple times at night to eat?
Right. Great question.
Yeah.
This is something that happened to me with my first. And he was 9 months and he was still waking up a couple times at night to eat. And I was hearing my girlfriends that were saying that their babies that were around the same age, oh, they're such a great sleeper, sleeping through the night, And so I was,
what's wrong?
I'm a bad mom. Like I don't have this figured out. So, and this is my story, right? This, everybody's going to have their own things that they want to do with sleep. But one night, I cried out for about 45 minutes. I was like, oh my gosh, I can't handle that. I can't handle it any longer. I'm just going to feed my baby. Tried it the second night. Same thing happened. Then I just said, you know what? He needs me, and I'm not worried about him not being able to sleep through the night at some point, and guess what? He slept through the night. He's been a great sleeper, but I answered those needs because that's what was really, I felt good about, and I also, as I got more education and more training, I started to understand that he had emotional needs that, maybe he didn't need those calories at the middle of the night, but he wanted to know where mom was. And he had those emotional needs, and I felt totally okay, doing that. So I think it's definitely going to be up to her, but I would say don't be alarmed that something's wrong, and it's totally okay to answer those needs.
And sometimes it's just a phase, and it just lasts a few months, and so you don't need to think the world is ending and they're not going to sleep through the night ever again.
Right.
And if it's turning into if it's turning into more than just a phase, and this has been going on for a couple of weeks, then you can consider sleep training. And, I educate people on this all the time, the crying it out method works. There is, proven data to show that it does work, but it's not very palatable to moms and, obviously to babies. They don't like it. But there's a more graduated approach where you can, like you said, you just felt like he wanted to know you were there. And so you can go in and you can check on them and give it 5 or 10 minutes before you run in. And then you can gently touch their tummy or their head, reassure them that they're there, and then turn around and walk out of the room. And then wait 20 minutes before you go in and do the same thing, and then wait 30 minutes. And if you're persistent about this for, about a week or so, then they'll learn that you're there. They'll also learn how to self-soothe and to go back to sleep, where now they don't need you to go back to sleep. So you fulfilled that need while they transition back to sleeping through the night, but you don't feel like you've totally abandoned them.
Yeah.
So I think there's a happy medium. And like you said, you can, everyone's going to be different. Every baby's different. What worked with baby one for a woman may not work for baby two. And,
exactly.
Sometimes babies have different needs. Some babies do need to eat through the night because they have nutritional needs, and the pediatrician can talk with moms who might have questions about that. Sometimes they do need to get more calories, and at night it's a good way to sneak it in. So,
and I think for this mom, it's never going to be the wrong answer to feed your baby. If that's something that you feel that they need and you're totally okay doing, it's never going to be the wrong answer. So that's great. And then, like you said, individual adaptation.
Yeah,
for each family.
Jessica says, when is it safe to introduce a pacifier? That's a good question.
Hot topic, right?
Yeah.
So pacifier is a thing that people go back and forth on, right? So we have research to suggest that the more that babies use pacifiers, the slower that they gain weight, and certain things, it could interfere with breastfeeding and certain things, okay? So we have that research. We also have research that shows that babies that use a pacifier, especially when they're sleeping, have a lower rates of SIDS, which is sudden infant death syndrome, okay? So that's a benefit, this is a benefit. So what do we do, right? So if you feel like, a pacifier is something that you want to use, there's just a couple guidelines that I would recommend. I would say, don't give it to baby when you see signs of hunger cues. So when they're pushing their tongue out, when they're alert and looking around, they're bringing their hands to their mouth, that baby's saying, Mama, feed me. Okay. So try not to use the pacifier as a mute button so you can get something done for another 30 minutes. Okay. Because that will start to stretch the feeds out. So there's more time in between. It'll decrease the amount of milk they get overall. And there can be problems there. Okay. But if you just want to use it like after a feed or in between feeds, just as a little soothing, totally fine and up to you.
So the difference is determining if they're wanting
they're
because
showing
they're
hunger
hungry
cues.
or because they just want to be
need a
soothed.
little more sucking. Yeah. And then the other thing is that if you've had a previous experience, sometimes moms will come to me and they're like, my first breastfeeding experience was a disaster and I don't have a good feeling about it. And I'm really nervous about baby number 2. I want it to go really positively and you don't want any variables in there, right? Then I would say for that mama, maybe consider waiting on the pacifier for maybe a few days to the first week, see how breastfeeding's going, make sure it's getting really well established, then start to introduce it if you want. So hopefully that helps.
And do different types of pacifiers make a difference?
Oh my gosh, right? There's about 5 million different types.
Yeah.
So usually moms just try a couple different until they see the one that baby likes.
And there's some that the ones with the little bulb on the end are easier for a baby to keep in their mouth. The ones that just have a straight end kind of, they're more like a natural nipple, and it's harder for the baby to keep them and those in their mouth. Is there any benefit to using those versus the ones on the bulb in the end if you're wanting to
I think that there's
stop nipple confusion?
There's also all different ones like orthodontic, type of considerations. So there's a ton of different options out there, and there's like not really one, this is the holy grail, this is what's going to help with nipple confusion at all. The one thing I would mention for safe sleep is that there's a lot of passies that have these little stuffed animals on them right now, right? Which are so cute.
Or that you hook to the baby, which you don't want to do.
So the ones that have a stuffed animal and that you hook to baby can be kind of a sleep hazard because American Academy of Pediatrics recommends no stuffed animals, no extra things in the crib, or like you said, attaching to their clothing when they're sleeping could be kind of a risk for their neck and things like that. So they look really cute and they're, feel like they can be helpful, but especially when they're sleeping, try to keep those little things away.
Yeah. Okay, she has another question. This is also from Jessica. Should I wait until a good latch is established before introducing the pacifier?
Right.
So an extension to that question.
Yeah. So hopefully my answer hopefully already kind of established that. I think it's up to you, but I think that that's a good idea, to make sure that you've got the latch down and baby is used to kind of your environment and texture first, and then do the pacifier as you feel comfortable.
So good latch without demonstration or pictures.
Here, I'll demonstrate real quick.
This show just got a lot more popular.
PG-13 rating. Just throw that up. Actually, no, just kidding.
Like we just got a whole spike in viewers right now. But there are some signs you can look for to see if a baby's latched properly.
Exactly.
Can you talk about that?
Yeah, sure.
Like the shape of the nipple, those kinds of things.
Shape of mom's nipple?
Yeah.
Okay. Like when baby comes off, you mean? Okay, we'll get to that. So first thing you want to do is make sure that you're tummy to tummy, skin to skin, okay, when you're first establishing this. So yes, take shirt off, take bra off, take onesie off baby, really just dress them down to a diaper. And tummy to tummy is important, and what I mean by that is tummy is facing and touching mom's tummy.
Yeah, have you ever tried to turn to the side and drink?
Dani knows where I'm going. She's just going to finish this for me. So if baby is chest to ceiling, then they have to turn their head to eat, just like you said. And so it's not as comfortable. You want their head to their toe to kind of be in a straight line. Okay, so that's the first thing. Positioning is huge. I can't tell you how many times women have called me to their homes and I just turn baby or do one little adjustment on the position.
That's the benefit to having a lactation specialist, because you can watch a mom one-on-one and make individualized adjustments so breastfeeding can be successful. I end up saying that a lot on Facebook when people ask questions, but it's because it's true. If someone can just watch you nurse, sometimes it's a simple little adjustment just like that. 100%. And then all of a sudden it's like, it works.
Yeah, for sure. So positioning is huge. And then also you want baby to be elevated. So, let me change that. You want baby to be supported. So if you're sitting up, that would be elevated. You'd want a pillow so baby hits about right here, not all the way on your lap.
And don't move to the baby.
Yes.
Move the baby to you.
Yeah.
And don't need to be like this.
And why? Because that's going to be the next question. My back's killing me.
Exactly.
And my baby's 5 days old. And why is that happening? Because we're hunching over. Yeah. So you want to actually recline back, if anything, and you don't want to, like you said, bring your breast to baby. Okay. The other position that we really love to teach is a reclined back position so that mom's body is supporting baby's weight. Okay. And it's something where baby's up and down on mom, and you they can frame the breast with their hands, and they actually can almost kind of flutter kick their feet a little bit and get to the breast. So positioning's huge. Whatever works for you, whether that's the reclined back position or sitting a little bit more upright. Positioning is really huge, and making sure baby's right where they need to be in close proximity to the nipple. So that's really big. And then putting baby's nose right on your nipple. Okay. That's going to help them. That's going to help them to be in great position to get a lot of the nipple in their mouth, because the more nipple that they can get in the mouth, the more comfortable it's going to be and the more milk they're going to remove. Okay. The other thing you want to make sure that the chin is touching the breast. That's a huge one. A lot of times we'll look and there's a little bit of space in between the chin and the breast, and we're not getting a good latch. And baby's not opening wide either when they go to breast. So as soon as we create contact with that chin, it's like a magic open button, and baby can open wide and take a lot of breast tissue in. Okay. So these are some little pregame, right? That you set all these things up for a successful latch. And then one of the most important parts and one of the most skipped parts is being patient and waiting for baby to open wide.
I love that, being patient.
Yeah.
You think it's going to happen instantaneously.
Right. Or you want to hurry the process along, or someone's watching and you want to show that you're a pro, right? So we got to wait, and we got to be on baby time, okay? For them to kind of get used to their environment. They might do their head back and forth to kind of feel where everything is. And then they'll open wide. And a lot of times they'll come on deep enough on their own if you just wait. Sometimes they need a little bit of a nudge. The only place you would apply pressure is kind of in between their shoulder blades with an open hand. Never want to push on the back of their neck or create pressure underneath their ears. You just kind of can give a little nudge there. So once babies come on, this is a really long explanation. They just need to take the classes, right?
That's exactly right. Someone is going to be able to get your online class. They participate.
Exactly. So those are kind of the precursor things that can set up, Then once baby's on, you go, okay, baby's on. Whew, I did it. What do I check on now? Okay. So you can look down. You want to make sure that the corner of baby's mouth has a wide angle. Okay. That's going to let you know that their mouth is open wide and they've taken a lot of tissue into their mouth. And as they start sucking, you'll actually notice a change in their body, cues, okay, kind of the way their body is. First their hands will be right up at their chin, okay, and it's kind of like they're at a trough ready to eat, right? Their brow will be really furrowed. Oh, I really need this food really fast. Okay, and as they start to get some milk, they start to open those hands. They start to relax their brow, and that's kind of a subjective way to know they're getting what they need. They're really relaxing. They're showing me those cues.
Go back to, instead of looking at your phone, look at your baby, right?
Exactly. So it's kind of like us when we sit at the Thanksgiving dinner table. Like if you have, a video of Thanksgiving dinner table, kind of sit there with your fork and knife and you're ready to eat and you're all uptight and your brow's very furrowed and then you start to eat and you start to
By the time you're done, you're like,
your hands are open. It's exactly the same with your baby at the breast. So those are some great things to look for in a latch. And then as you added, how should my nipple look when my baby comes off the breast? So we don't want it to look pinched, and we don't want it to necessarily look like a tube of lipstick when it comes off, because that probably means that baby wasn't on deep enough, didn't get enough tissue, so areola and breast tissue, and when baby was latched, they probably were getting mainly nipple. Okay.
And improper latch is the number one cause of pain, right?
Exactly.
So if you're having pain, again, it goes back to the importance of having a lactation specialist watch, make sure that the latch is good, and that you can get rid of that pain just by making a few simple adjustments.
Exactly. And then also, if you're having pain that lasts longer than the first minute of the feed, go ahead and stop right away and start again. So you want to put your finger in the corner of baby's mouth and start.
Don't just pull them off.
Right.
We've all learned the hard way.
Niplash, we call that, you know.
I love
You
that.
want to stay away from that. But what I'm saying is don't let that feed go on for 5-10 minutes when you're excruciating pain. Quickest way to get kind of some breakdown on your nipple. What I mean by that is like kind of like almost a skinned knee appearance, which is what we want to stay away from. So the pickier you are about how it's feeling, probably the better experience you're going to have, and also the more you can stay away from pain.
Those are all amazing suggestions and tips. Where were you when I had my first? Honestly.
Oh my gosh.
Breastfeeding did not go well for me with my first, and this would have been this is like a gold mine of information.
You're so sweet.
So tell people again where they can contact you if they have more questions or want to take your class.
Yeah, our biggest support forum is on Instagram at Lactation Link, and they can also check out the courses and actually free content on lactationlink.com. You can always shoot me an email too if you want, Lindsey@lactationlink.com. You can schedule consultations on our website, and you can watch our on-demand classes right now, anytime that you need help.
Awesome.
So,
thank you so much,
thank
Lindsey,
you.
for being
It's so
here
fun
today.
to always be on here with you guys. I love it.
I love it. I love it when we get to see each other and hang out.
Yeah, great questions, moms, for sure.
Yeah, thank you so much for all of your interaction. And you guys know where to find me, of course, on Facebook. And we'll be doing a live stream again next week. So be sure to tune in. Have a great day, everyone. Thanks.
Bye.